The surgical scrub is the process of effectively reducing the number of transient microorganisms on the skin, reducing resident microorganisms and retarding their regrowth by mechanical washing with antimicrobial agents. Sterile gowns and gloves and protective personal equipment, PPE, for example eyewear, double gloving and impervious gowns and aprons, are worn by all members of the surgical team to minimize the risks of wound infection and to protect the staff from biohazards. There is a range of disposable gowns available depending on the level of protection required or the surgical procedure being undertaken. The fundamental principles of aseptic technique and standard precautions should be adhered to in relation to scrubbing, gowning and gloving prior to any surgical intervention. An issue to consider prior to scrubbing is the type of glove to be worn. The increased use of latex products in our daily life, in particular healthcare, and the use of standard precautions has led to an increase in latex sensitivity in both patients and staff. Increasingly, many hospitals are changing to powder-free gloves as the first step towards a latex-free environment. You should make yourself aware of the policy relating to the use of latex products in your hospital. You will find there are a number of different gowns available. There are reusable gowns, such as linen, although current Australian standards are advocating a reduction in the use of linen gowns as they are not considered an effective or reliable microbial barrier. There are disposable gowns made of non-woven polypropylene, and there are resposable gowns which are made of coated linen and can be reprocessed a limited number of times before being disposed according to manufacturers' recommendations. Prior to commencing the surgical scrub, all personnel should be correctly attired, ensuring that all hair is covered and masks are secure. There is a variety of protective eyewear available. You should select items which comply with Australian standards, as these will provide front and side eye protection from splashes. If you wear prescription eyewear, you will need to have additional protection to achieve the same effect. All jewellery should be removed from hands and arms, as these items harbour microorganisms which could contaminate the surgical wound. Hands and forearms should be free of any lesions, and the fingernails should be short, clean and free from nail polish. Artificial nails should not be worn. Research has shown that chipped nail polish and artificial nails cannot be properly cleaned and provide a place for microorganisms to multiply. The same scrub procedure should be used by all staff. The principles of the scrub techniques demonstrated in this video are: hands remain above the level of the elbow at all times. Antimicrobial solution must contact all surfaces of the hands for a minimum of 2 continuous minutes. Antimicrobial solution applied to fingertips and hands, then in a circular motion down the arms. Don't return to the hands. Hands are rinsed from fingertips to elbows in one direction only. Avoid splashing water on operating room attire, as this can lead to contamination of sterile gown by strike-through. There are many antimicrobial agents which can be used. 2 of the most commonly used are povidone iodine and chlorhexidine. The solution chosen should have a broad spectrum of activity in the reduction in numbers and inhibition of growth of transient and resident microorganisms. The agent must also have a rapid, persistent and cumulative action and have minimal harsh effects on the skin. If you find you have an adverse reaction to povidone iodine or chlorhexidine, there are alternative solutions available, and you should seek assistance from your occupational health and safety representative. Prior to commencing the scrub, you need to open a sterile gown pack using aseptic technique. Gown packs generally come in a variety of configurations. Select the gown pack appropriate to the number of people who will be scrubbing with you. It is preferable for your scout nurse to open the sterile gloves for you, as flipping items onto a sterile field is not an ACORN recommended practice. However, in an emergency, or as circumstances dictate, you may open the gloves onto the sterile surface of the gown pack, remembering to use aseptic technique. Double gloving is current recommended practice.